So what I want to talk to you today about is our digital full arch procedure that we carry out at 3Dental. And we've been doing this for over a year now, and it really produces amazing results for us, and I want you to know what it's all about as well. So I know a lot of you are unfamiliar with some of these terms, so I'll run back over it again, and then you'll have an idea of exactly what we're talking about. So full arch is providing someone with fully fixed in teeth in just one single day. And it involves a bridge that's fixed on a minimum of 4 dental implants. This is a schematic diagram of what it looks like. You've got some teeth here on the bridge and 4 implants which are inserted into the jaws. So it involves minimal disruption to the patient and minimum time out of their lives. Suitable for people who are losing their teeth or people who don't want to wear a denture, and also as well for people who have got a denture and want to get rid of that denture. So it involves all of the teeth in the upper or lower jaw to be replaced, and at 3Dental our prices start from €11,000 for this treatment. I'm just going to show you a case here just to give you an idea of the aesthetics and what we can achieve. So this lady had a number of decaying teeth and missing teeth. She was wearing a denture and she hated it. She wanted to change things. So we digitally designed a smile for her, and then in one single day we produced this result here. So this is her temporary bridge. It's based on some implants. And when you lift her lip up, what you'll see is the join between her temporary bridge and her own gums. So this is never visible during a normal smile. And when people are talking and laughing, you just don't see that. And then from the palate side, this is inside her mouth. You can see the palate is clear. So it's good for someone's taste, for their speech, feels more natural in their mouth. These little holes here are where the bridge is screwed onto the implants, and this is some temporary cement, so it looks like you can see little smears around it. When the bridge is taken off then, what you've got underneath are these, and these are abutments that sit on top of the implants, and this is just gum tissue. So that's how the bridge is held in position. And this is the patient's final bridge. So this is made of a porcelain material, it's zirconia, and it's based on our temporary bridge. So the temporary bridge is digitally designed, taking the face into account, and if we're happy with that, then ultimately we proceed to a final bridge, maybe 3 months or 6 months down the line. So on the video, you'll see me turning around the bridge. You'll get an idea for its aesthetics. So this feels really nice in somebody's mouth. It's very clean and smooth. The appearance is lovely as well. So underneath, these little metal caps are what attach it onto the implants, and that's screwed into position with 4 very small little screws. And then these holes that you see on the biting surface are covered over with a filling material. So some of the problems we would have had in the past, or what the people who don't do things digitally would have, is that they have a temporary bridge, but the temporary bridge mightn't be that great. And then to improve on that, to get to the final one, can take a number of steps and be quite laborious. Whereas with the digital process, what we do is we take account of the face to begin with. So when we design our bridge, we can design it in 3 dimensions, and we can design it digitally in our lab, using the face and the existing teeth, so we can get the aesthetics perfect with the temporary. And then when we make a final bridge, we're just copying what we have with the temporary. If there are some alterations to be made, they can be made digitally. We can make a new temporary and put it into the patient's mouth. So it means that there's a seamless transition from the temporary to the final, and you can get a very accurate copy of the temporary in the final. Previously, and with other techniques that people use, it's very difficult to copy the temporary in the final bridge. Sometimes it's impossible. So someone might have a very nice temporary, and then when they get to the final, it isn't so nice. So we get around that. I wanted to put this up because this is that same patient actually. And so you can see from the review, you can read it yourself, that she is really, really happy with the results. And what I really like about it is that she mentions a number of elements of the clinic. And you know, all this work is done on site. So she mentions our dental lab, which is super important to me because these are the guys, they're kind of the unsung heroes. You know, they do a lot of the aesthetics, but they don't get a lot of the plaudits. But I'm very keen to involve them because they're great. Procedure was painless, that's good, yeah, I'd like to hear that, and it is painless, it doesn't hurt. And she's very, very happy with our results. And I think what really makes me so happy as well is she mentions all the staff, you know, so it is from the front desk to the surgery, you know, to the lab, everybody's involved in this. It's a real team effort, and you know, that makes me really happy to see that. She really ticks all the boxes in regards to our team, and she can't stop smiling. So that's great. It encompasses and encapsulates exactly what we're trying to achieve here. So some problems that other clinics would have when doing full arch procedures is that they plan only on stone models of the mouth. So they take a mold, and they would use those stone models to try and plan the treatment. But this takes absolutely no reference of the face, which is super important in terms of getting the aesthetics right. So the problems they would have then would be too much or too little show of the teeth. So the teeth look like horse-like, or you can't even see their teeth, you know. Or the midline can be off-center, so there can be asymmetry to their smile. The smile can also be canted, which means tipped. You know, the horizontal can be wrong. Or the occlusion, which is a fancy term for the bite, can be incorrect. And as I said, this is what other clinics do. This is not what we do. There can also be difficulty in copying a good temporary bridge. So when we use a digital workflow, if we've got a good temporary bridge, we can perfectly copy that. And so the final, we can guarantee you it's going to look the same as your temporary. Patients do often ask, will my temporary bridge look exactly like this? And I can guarantee you, most definitely will. There is a long process to making a final bridge using an old analog technique, molds and that kind of stuff. We don't do that. We get a very tightly fitting prosthesis. So non-passive means that it fits perfectly on all of the implants at the same time, which is very important for not causing stress on the implants and for improving the longevity of what you're going to get. When people outside of 3Dental, when they take impressions, they use gooey impression materials that can distort, which can lead to fracture of bridges or even implant failure. So the solutions that we've come up with then is a fully digital workflow using our intraoral scanner. So that's a scanner that scans inside somebody's mouth. We've got a face scanner, which scans from the outside and captures the face. We merge these two together then. We have 3D printers, which print off our temporary bridges in resin. And we also have got a milling unit for milling our final zirconia bridges. This here is an example of our intraoral scanner. And that's kind of what it looks like. When it's held in the hand, it's that kind of shape. So this little bit here goes into your mouth, which means no more gooey impression materials. This is a massive leap forward in terms of technology. So this is an example of the intraoral scanner at work. So it's put into the mouth and you run it along the teeth. And what you'll see is it picks up the existing dentition. So the teeth that are in somebody's mouth. It's very, very accurate. So we can be sure that our records are going to be absolutely spot on. And that improves the accuracy with our implant treatment. So as the scanner goes, it's quite cool actually. What you'll see it do, it's picked up in my glove here, and it'll cut that out in a minute because it knows that it's not teeth. So it doesn't record things like the tongue. In this image down here, you see the tongue there, but it's quite intelligent. So it spots exactly what it needs to pick up and what it doesn't need to pick up, then it cuts out. So this scan is then sent to our lab, and they merge it with a face scan, which I'll show you again in a few moments. So this is a very important part of the technology for us and our full arch treatments. This is our facial scanner. It's a handheld device. So as it sends out pulses of light, they reflect off the face, they come back to the camera, and it captures the face in a 180-degree panorama. And then that image is reconstituted, and the technicians have a three-dimensional representation of your face and help them to put the teeth in the right orientation. And they can look at exactly how the teeth should be positioned and come up with a really beautiful smile. I'll show you more of that later. This is a 3D printer, and we use these printers to print off our temporary bridges. So on the same day, you'll be able to walk home with your new set of teeth. And when it comes to making our final restorations, we have one of these milling units from Zirconzan, and they help us to produce our Protau zirconia final bridges. This is a little animation of what goes on inside. It's quite hypnotic. I like looking at it. And you can see here a little drill working away. It cuts out the zirconia from a circular puck of material based on the design that we have from the lab. When the guys take it out, then they stain it, they glaze it, they make it look nice, and then we fit it into the patient's mouth. So in terms of our workflow, this is how it happens. Somebody comes in for an assessment, and we also take a cone beam CT or a 3D CT of their mouth. We can tell exactly then how much bone they've got and whether they're suitable for the treatment. And if they are, then we would go ahead and we would have a records appointment where we would record the scan inside somebody's mouth, and we take a scan of their face as well. This information then goes to our dental laboratory, and they design a smile for our patients. So then we show the patients the smile. We have a smile trial appointment where the patient would come in, we would show them what's proposed, and they would have an opportunity to talk to us about that. And we'd have a conversation as to whether they like what they see or if they would make any adjustments to the design before we actually go and do our surgery. So then a couple of weeks later, we have our surgery appointment. Teeth are taken out, implants are put in, and we take scans again of the patient's mouth. And then that same day, the patient would have their temporary printed bridge put into the mouth, and they leave the clinic before 5 p.m. with the teeth that they've come in to have their new smile. And then 3 or 6 months later, we again take digital impressions, so no gooey stuff, just scans of the mouth for our final bridge. And in most cases, it's 2 appointments to make a final bridge. And then we fit it. And then after that, patients will come back for routine visits, hygiene, that kind of stuff, every 6 months or so. So I'm going to take you through a case now which illustrates this workflow and maybe makes it a bit more clear to you. So this is a lady who had a lot of problems with her teeth, several broken teeth, teeth that are missing, and teeth with gum disease. So a whole host of problems here. When we lift the gums back, we can see broken tooth here, chipped and broken teeth and missing teeth. And when she bites together, there's virtually no bite here. There's no back teeth to chew with. She finds it very difficult to function. So again, what we did was we took a face scan and we took scans of the teeth and merged these two together. So this is what things look like in our pre-op condition. And then we've done a design. So this is our digital design, which we've approved. We've shown these images to our patient. She's approved them, and then we've gone ahead to surgery. We also produce a surgical guide, and this is something that on the day of the procedure, we have a plan that we can work to. So it's like an architect. Architects got plans, the builders come in, and then they build the walls according to the plans. These are my plans, and I put my implants exactly where this plan tells me they should be. So this is the case again beforehand, and that's the case afterwards on the day of surgery. So these are her temporary teeth, which are exactly as planned from our preoperative design. So the advantages then, it offers us our greater patient engagement. So our patients have got a say in what happens in their mouth, which most of them really want. They want an opportunity to not only see what they're going to get, but offer an opinion as to whether they like what they see or not. And I don't think any clinics offer that. It is facially driven. So, what's important about a smile are a number of things, but the size of the teeth are related to the patient's face, and the positions of the teeth are related to the positions of the nose and the eyes. And in other clinics, they do not take any heed of this information. As I said, they take molds of the mouth and they operate on that basis alone. They don't look at the rest of the face. So we get very predictable aesthetics, and there are much less modifications between the temporary bridge and the final bridge. We get a much earlier finish on the day of surgery, so the patient gets to leave a lot earlier than traditional methods. And it requires minimal adjustment to the bite on the day on the evening when the bridge is fitted. So it's less time in the chair for the patient. It's also easy for us to make changes in appearance. So if we make a temporary bridge and we put it in and we decide that we don't like what we see, or we would like to show more teeth or less teeth, the guys in the lab can redesign a temporary bridge very easily. It can be printed off in a matter of 40 minutes or so and then fitted into the patient's mouth. So changes are simple. We get restorations, we get bridges that fit passively on the implants, so there's no strain or tension put on the implants because the scanning process is so accurate, and that leads to increased implant success. And we've got much less appointments for the final bridge. I'm going to show you another example of our smile design. So this is a young lady who unfortunately had a lot of cavities in her mouth. She was in a lot of discomfort with these teeth. Obviously they don't look very good, and she was very embarrassed by the appearance of what she saw. Again, we go into our process, we scan the mouth, we scan the face, we merge the two of these together, and then what we have is a design. So this is produced by our lab. They verify with the patient, and we go to surgery. Again, a reminder, this is what she was like beforehand, and this is the day of surgery. So these are just temporary bridges produced on the same day. So implants go in, she walks home, walks in like this and walks out like that. So quite a stunning change, really. And in this case, we've managed to shape the teeth appropriately for her lower lip. You can see that the teeth follow the lip. The midline, the middle of her face is dead on. There's no, nothing's up or down. It looks very symmetrical. And we've chosen the shape of the teeth based on the shape of her face and the dimensions of things like her nose, her eyes. So it's all very harmonious and fits in exactly with who she is. And I'll show you some other examples of things that I've seen. So this is a sloped or canted smile. So this lady has had bridges done many years ago. And this is a very good example of why Stone models don't really work. So she's had some asymmetry of her face, and she's lived with this for many years. These are now failing. This is loose and falling out. So we did a full arch solution for her, and this is the result. So this is the day of surgery. This is her temporary bridge in position on the same day as she's had the teeth removed and the implants placed. And we've managed to correct the slope. We've put in teeth of better proportion. We've got some nice characteristics here. So they look like natural teeth. The edges aren't just flat and worn. It looks like a real smile. This one here is an example of the midline being off. So the middle of this person's face is here someplace, and these teeth are off to just one side. So she was born this way. She's just asymmetric. Perhaps she lost some teeth as a child, and then these drifted over, but these are crowns on natural teeth. The crowns are failing, by the way. She's missing some more teeth here. But this is impossible to correct through any other means. There's no way to do this. We adopted the full arch solution and with our facially driven planning, and this is her final bridge here. So you can see the middle of the face is on. There's no slanting. We've got nicely shaped teeth, so the canines have some points to them, some roundedness to the incisors. It all looks very natural. Some challenging cases would be ones with a very gummy smile, like this one here, for example. So this lady, when she smiles, her lip is very active. It shoots right up. You can see she's very unfortunate. She's had a lot of gum disease. You know, the gums have receded back. Gum disease is a very common reason for people losing their teeth. And these teeth are loose and waving around the place. So they look unaesthetic, but they're sore, they move, they're not very nice. And then this is our temporary bridge in position. So we've taken account of her smile line where the gum is lying. We've changed it a little bit, but you can see nice appearance to the teeth. So it's proportional to her face, and it suits her very well. The next little bit I'm going to talk about is the bite. So this is another area where the digital workflow comes into its own. We call it occlusion, fancy term, dental term for just the bite, how your teeth meet. So this gentleman, he has some decayed teeth, you'll see here, and then on the top, this is actually a denture. And if I take the denture out, this is what he looks like. There's some decay in this tooth as well. So in total, he doesn't have very much that's going on there. These teeth are in a very bad way. And yeah, his bite was not good. So we did our surgery all in one day, teeth out, implants in, temporary bridges, and this is what we get. So, you know, the teeth meet perfectly. The middle of the upper is coincident with the middle of the lower, and the back teeth knit together really well. So he's got a stable bite as a result of our digital planning. Again, another case, so this lady had gum disease, and over a number of years she'd lost some teeth, and the remaining teeth she had started to spread out. So there's a huge gap between the teeth, which wasn't always there. Gaps here as well, and the teeth just look unaesthetic. They look very stained. And when we lift the lips back, this is what you see. So from the side, then you can see how the teeth are proclined. They're pushed forward. It's very common with gum disease. Happens quite a lot. And from the other side, it's the same deal. You know, these are the front teeth, the back ones. They're being pushed out. Shouldn't be in those positions, but that's what happens as a result of this. And then we do our surgery, and these are her temporary bridges. So same day as she has the surgery, you can see some stitches, telltale signs, some stitches there. And again, what I want you to see here is the fact that the middle is on. So the top and bottom, they meet perfectly. The back teeth, they also intermesh very nicely. So this lady is able to go away and eat comfortably immediately after her surgery. Same patient, if we look at this is the upper bridge viewed from the biting surface. You can see the holes where the implants are put in, and so our palate is clear. Also, what's quite important here is the positions of the implants. Okay, so the implant positions are right in the middle of the teeth at the back, and at the front, they're just behind the tips of the front teeth. So what this means is that we can keep the bridge as thin as possible, and it leads to a prosthesis, a bridge that feels much more comfortable in your mouth than one where the implants are put in bad positions. And I see this a bit, implants in bad positions, because they're not planned beforehand, and then you end up with a bridge that affects speech or comfort in your mouth. And then this is the lower bridge. Again, if you look at the positions of the implants, they're all right in the middle of the bridge, exactly where things should be. That's the tongue down there. And when she closes together, again, we get a nice aesthetic appearance. It looks very natural. It looks like it belongs in her mouth. And from the side, there we go. So we've pulled the teeth back in again. They're not flared like they were before. I would call this a total rehabilitation. So we do see some patients as well who are, in bad conditions for any number of reasons. And this gentleman had a lot of trouble with his dentition, entirely decayed. He'd grown a mustache to cover it. This happens a lot with gentlemen. They're embarrassed about their teeth. They grow a beard or mustache to hide what's there. And when we lift the lips back, this is what we see. So very, very decayed dentition. And after our surgery, this is what we get. So it's a nice result, top and bottom. And again, patient is back to full function. And in smile, that's what he looks like there. So already, mustache is gone. He's happier with his smile. He's shaved it off. I see this so often. You do the treatment, they have a nice smile, and suddenly they want to show it off. So the beards, the mustaches go. So this is a multidisciplinary case, and it was treated by me and also one of my colleagues. So one of my colleagues, he did the treatment on the top, and I did the treatment on the bottom. So I'll just show you the kind of problems this guy was experiencing before we started. He has an underbite. So his lower teeth are sitting in front of his upper teeth, which is the wrong way around. It should be the upper ones on top of the lower ones. And as a result of that, he's lost some lower teeth here because the bite has been traumatic, and he's got some chipping and breaking to these other upper front teeth. He also has almost no lower back teeth, so he doesn't have a bite. Can't eat properly. When he opens up, you'll see the damage that's been caused to these upper front teeth. They should be at this level, but they're worn up by his lower teeth being in a cross bite like that. So you can see the crossing of the bite here on both sides. And what we decided to do in his situation was to remove the lower teeth and provide him with an All-on-4 solution for that. And then on the upper, we did some crowns and some bridges, and they restored the appearance of those teeth. So we brought the upper teeth forward slightly, the lower teeth back, and this is our end result. So he's got this is his temporary bridge on the bottom and the final result on the top. So his bite is back to where it should be. The lower teeth are behind the upper front teeth. And that's a picture of his smile there. And then the next one, this is his final bridge. So this is the final one. You see again, the midlines are right on. We got a good bite at the back on both sides, so he's meeting together very well. And he's got a nice aesthetic appearance. So the top and bottom match really well. And he's finally got a smile back and he can eat properly. Thank you all for sitting through this, if you've made it to the end. We know it's a longer video than we'd normally produce, but for certain people, they really want to know the nuts and bolts of what's happened or what happens in the treatments that we do. And we thought that this video would be a good opportunity for people to see exactly what happens behind the scenes and get a deeper understanding of how the treatment happens. So if you have any further queries, you could give us a shout or come in for a consult. If you visit our website, 3dental.ie, you'll find multiple ways to contact us there, and you can give us a call either and arrange a consultation.